The blood cancers are a little bit more aggressive, but when the lymphomas are of two types, like most aggressive, like moderately behavior wise, and they are low grades.
Okay.
So there are like 3 grades in lymphomas. Blood cancers are generally more aggressive diseases. They start in the bone marrow, they stay in the blood. When they go into the lymph nodes, we call them lymphoma.
All right.
Okay.
Okay. So we have spoken about the symptoms, what one would feel. Why do we say that it afflicts more younger people? Again, I'll ask you because, 15 teenagers, 20s, 30s, why those people?
See, we do not have a clear understanding of why this age group, but generally speaking, it is the immune system that is, at the stake. Immune system is the one that would help an individual fight different infections or take care of how the body would respond to foreign sort of allergens and that sort of thing. So at this age there are some changes in the immune system that makes it more, there is more propensity to develop these lymphomas.
Okay.
Needless to say, it can happen in other age groups too, but this is just sort of a high propensity.
Okay, and also we, I guess we are also professing it like that because we want people to be more careful. Children probably, or youngsters, they wouldn't probably care of what is going, maybe it's just a sore throat or something, they wouldn't really, look into it too deeply. So what next? So somebody comes to you, this is what you diagnose, and is it like a very threatening kind of a cancer?
See, in the past it was very threatening. Now, alhamdulillah, with the recent, advances in medical science and research, we are able to sort of, control, I won't say cure, but we are close to cure in most of these diseases. The new treatments in lymphomas are very good. So basically, apart from the medical management, now there is like sort of more immune system medications too. The old phenomena was chemotherapy. Like those are injections that are blind, they go into the blood, they circulate all around the body and they kill all the normal as well as the lymphoma cells. But now we have much more, sort of targeted therapies that are given intravenously, but they target only the lymphoma cells and they leave the rest of the body.
Okay.
So with these advances, I think we have supplemented the treatment of lymphomas throughout the globe. And with this advance, I think we are very positive that in future we would develop more of such sort of treatments and chemotherapy will just fade away.
Okay.
And anybody would have come in with a lymphoma and you would just give a targeted treatment and that would convert the disease like into blood pressure, or in ordinary terms, like somebody has diabetes or blood pressure, they take medicines and they stay at home.
Exactly, because the term as it is chemotherapy, and again the good cells and the bad cells both are killed in it, and that in itself causes a lot of other problems in a person as well. So this the targeted medication, I would say, is it happening in Pakistan? Is it available in Pakistan?
Yes.
Are we in it?
See, going into a little bit of the detail, lymphomas have T as in Tom and B as in boy, T and B lymphocytes.
Okay.
So there are a couple of targeted treatments that go into the body and they target CD20 lymphocytes. One of those medicines is called Mepthera. Internationally it is called rituximab, and this is a monoclonal antibody that goes into the blood and targets the CD20 lymphocytes. The CD20 lymphocytes are the main culprit in B lymphomas. Similarly, there are some other targeted treatments that go into the body and target the T lymphocytes.
Okay.
So if somebody has a lymphoma of B cell, we would use this medicine that would target only the B lymphocytes. If somebody has a T cell lymphoma, we would go in and give some medicines that will just target the T lymphocytes.
Okay, so there is a division in also the treatment of different kinds of it.
Sure.
As well. Okay, that's interesting. So you would say, or I would think, because we have discussed on this show as well different kinds of cancers as well. This seems, I guess I'm being very optimistic when I say this, that it can be controllable if somebody comes to you at an early stage.
Quite true. Depending on this, the subtypes, there are a few very aggressive and there are a few very indolent sort of lymphomas. And besides chemotherapy and immunotherapy, there are a couple other treatments too. The highest one is a stem cell transplant, or in ordinary terms we call it like bone marrow transplant.
Yes, of course.
If the chemotherapy and the targeted therapy does not work, Then we take and the patient is stable. They can withstand the disease. Then we take them to the next level of bone marrow transplant.
Okay.
In which, we take the stem cells out, we process them, give them a total body radiation or some aggressive chemotherapy, and then we put their cells back into the body after cleaning them. And the idea is that they would go into the bone marrow and then start producing normal cells. So, it is a sort of a gambit of treatment modalities that you use depending on where the disease is and how it is behaving.
Absolutely. And obviously different from person to person as well.
Quite true.
How much a person can take. Now I have a couple of questions here which really are, more for the information we want to provide to our viewers. Now, can this disease transfer from mother to child or generation to generation?
See, generally it is not, but there is an HIV related lymphoma that can cause it is called vertical transmission from mom to the fetus, and then sort of, that kid will also, if he or she has HIV, would be at risk of developing lymphoma.
So that is one way. And I mean, if they say that there are certain families and a lot of family members have cancer or that kind of cancer, so more at risk?
See, most of this research is done in Jewish ancestry.
Okay.
And yes, there are some syndromes, familial syndromes, in which lymphomas also happen a little bit more. And those patients and those families have more immune system problems in general too.
Okay.
But unfortunately, that research is probably not applicable in our setup in Lahore or in Pakistan.
All right.
Because this data is mostly from, as I mentioned, from Jews, and it belongs to them.
So as it is, and if we disregard lymphoma cancer for a while, and I've really heard this, if the aunts and the khalas and the mamus and everybody, a lot of people have cancer, then they say that you should get yourself checked as well, because you have more propensity, as you were saying, to have
right.
it.
See, this mostly this is sort of the most common example is breast cancer in women. There are breast cancer associated genes called BRCA1 and BRCA2. If somebody has
That's
those
BRCA,
genes,
I think a lot of people
BRCA1 and
heard this
BRCA2.
one. Right.
If somebody has this gene, they have a very high risk of developing this disease. And such are the patients or people, I would say, not even patients, who get their frequent screening. And if it is not only related to breast cancer, those individuals are at high risk of developing pancreatic cancer, gastric cancer,
any
and
other
even
kind
ovarian and endometrial, like uterine tumors. So yes, in the West there have been much more advancement in which they pull out those families, they look at their genealogy, and then those individuals who have such genes, they are offered mastectomy, removal of the breast, and oophorectomy, removal of the ovary, and hysterectomy, removal of the uterus.
Just as a
young age.
preemptive, because their history tells them that this just might happen.
That they have they have such a high risk of developing those tumors that either they have very close screening, or at some age when their family is complete, they are recommended to undergo such surgeries.
Exactly.
So as not to develop those malignancies down the line.
Okay, interesting. Finally, can a patient enjoy a normal life after the treatment of lymphoma cancer, back to lymphoma?
Yes, yes, I would say the treatment is a short era of 4 to 8 or 6 months, in which a patient comes in and out of the hospital once or twice a month, getting chemotherapy and targeted therapy and going through some of these side effects. But once this treatment is done, depending on the type of lymphoma, the only thing they need is follow-ups. But after this, a lot of patients recover and they have a healthy life.
And what are the chances of it recurring?
Say, again, that depends on some types of, there are some indolent lymphomas which are very hard to cure. We control them, we put them to remission. But then after a few years, if there is a trigger in their immune system which we are not aware of, there is a high propensity that the disease might come back. But for that reason, until and unless we know what to do, we just try to follow up and see if that disease is coming back by doing repeated CT scans, blood tests and clinical exams.
And that is why follow-ups are very important when somebody goes.
They are.
All right. Thank you very much, Doctor, for coming here and giving us such detailed information on this kind of cancer. And we'll call you again, inshallah, to talk in detail about it. Dr. Hassan Pervez there. And we are going to take a very short break. We'll be right back after this.
Thank you.
Thank you very much, Doctor. Hello, welcome back. I hope you were taking interest in what the doctor had to say, because it can happen to absolutely anybody, and it's better to know what precautions to take, what you can do about it if it happens. We are talking about lymphoma cancer there. Quotation time now, and this one I personally picked because it was so interesting. This is on boredom, the quote, and I think it will click with a lot of people. On your screens now, Bertrand Russell said, boredom is a vital problem for the moralist, since at least half of the sins of mankind are caused by the fear of it. How about that? And that is why, people also say that an empty mind is the playground of the devil, or something like that. There was another quotation as well. So this is, everything is born through boredom. It makes you do weird things. Oh well. Come here now. We're talking about the word here, and the word sounds really interesting today, and I really wanted to pick it up. I don't know how useful it will be for you, but still it's an interesting word. Roll drums please. And the word of the day is moxie. See what I mean? Moxie. If not anything, it's a good word to know when you're playing Scrabble, because there are hardly any words with an X in it. So moxie means courage and aggression and aggressiveness, rather, courage and aggressiveness, vigor or skill or know-how. But I'll give you an example and you'll have a better idea. The reporter showed a lot of moxie when it came to looking for just the right piece to be his front page expose. Yeah, and another one, it took a lot of moxie to stand up to her friends when she knew they were wrong. So courage, basically, I think you could use this word for. I like it. I want to say it again and again. But now I don't usually do this, but I am going to make an exception today. I'm going to use this platform to trash a movie I devoted 3 hours of my Sunday afternoon to yesterday. I'm talking about Love Mein Gum, a movie by our very own Reema Khan. Yeah, I must confess that I did not go with very high expectations. My only reason being to support our film industry and actually watch a latest Pakistani effort before making up my mind. What can I say? There was absolutely nothing in the movie that I would call good. The storyline was not believable, the characters were weak, and the songs and styling were over the top. I'm almost hurt that we can't do better than this. Very, very disappointing. Yeah, please don't watch it. Oh well, this is it for today. I'll catch you tomorrow. Take care. Be safe. Seize the day.